Thank you for subscribing to this channel. This is a reading part C practice video.
The correct answer is D. More understanding is needed to overcome it. In the fifth paragraph, Dr. Charles Penn emphasizes that a key factor contributing to antibiotic resistance is the poor understanding of the differences between bacteria, viruses, and other pathogens, as well as the value of antibiotics. He also mentions that misconceptions about antibiotics are perpetuated by marketing and advertising campaigns that use generic terms like germs and bugs. Dr. Penn's viewpoint suggests that increasing understanding among both healthcare professionals and the general public about when antibiotics are appropriate and effective is crucial to addressing antibiotic resistance. Now, let's examine why the other options are incorrect. A. Increasing their cost would deter overuse. This option is not supported by Dr. Charles Penn's statement. He doesn't mention increasing the cost of antibiotics as a solution to antibiotic resistance. Instead, he focuses on the need for better understanding. B. The general public should be held responsible. While Dr. Penn discusses misconceptions among the general public regarding antibiotic use, he does not explicitly state that the general public should be held responsible for antibiotic resistance. His emphasis is on the need for improved understanding. C. Mass media plays a crucial role in its demand. Dr. Penn does mention the role of marketing and advertising campaigns in perpetuating misconceptions, but he doesn't suggest that mass media alone is responsible for antibiotic resistance. Again, his primary point is the need for better understanding.
Let's look at the next question.
The correct answer is B. Justify the need to change our habits. In the 6th paragraph, Dr. Penn provides examples of our dependence on antibiotics to illustrate the importance of changing our habits regarding antibiotic use. He mentions various medical procedures and conditions where antibiotics are crucial, such as surgery, cancer treatment, intensive care, and more. By highlighting these examples, he is emphasizing that over-reliance on antibiotics for various medical benefits has contributed to drug resistance. His intent is to underscore the need for a change in our habits and practices regarding antibiotic use to combat antibiotic resistance effectively. Now, let's examine why the other options are incorrect. A. Stress that substitute medications are needed. Dr. Penn's statement does not explicitly stress the need for substitute medications but rather focuses on the importance of changing our antibiotic use habits. He mentions situations where antibiotics are currently essential. C. Show that it's too late to reverse the damage. Dr. Penn's statement does not suggest that it's too late to reverse the damage caused by antibiotic resistance. Instead, he is emphasizing the need for change and preventive measures. D. Highlight our lack of appreciation for current treatments. While Dr. Penn does mention that we now take for granted that many infections are treatable with antibiotics, his primary focus is on the need for changing our habits and practices regarding antibiotic use. The aim is not to highlight a lack of appreciation but rather to stress the urgency of addressing antibiotic resistance.
Let's look at the next question.
The correct answer is C. Once believed there was an endless supply of antibiotics. In the final paragraph, Dr. Penn highlights that in the past, medical practitioners, physicians or prescribers, became somewhat complacent about preserving the effectiveness of antibiotics because they believed that new antibiotics would always be available. This suggests that they once held the belief that there was an endless supply of antibiotics. However, Dr. Penn also notes that the pipeline for discovering new antibiotics has diminished in the past 30 years and has now run dry, which means that the assumption of an endless supply is no longer valid. Option C accurately reflects Dr. Penn's point in the paragraph. The other options do not fully capture the essence of his statement. A. Have depleted the supply of antibiotics through overuse. While antibiotic overuse is a concern, the paragraph primarily discusses the past belief in an endless supply of antibiotics, not their depletion through overuse. B. Were reluctant to take advice regarding antibiotics. The paragraph does not mention reluctance to take advice but rather focuses on the belief in the availability of new antibiotics. D. Are yet to understand the damage caused by their actions. The paragraph does not suggest that medical practitioners do not understand the damage caused by their actions. It discusses a shift in awareness and practices regarding antibiotic stewardship.
Let's look at the next question.
Option A, prescribers being attentive to the problem, is correct because the phrase, heeding the warning, means that medical practitioners are now paying attention to and taking seriously the warnings and concerns about antibiotic resistance. This phrase indicates that they are actively addressing the problem by being more attentive and cautious when prescribing antibiotics. It signifies a positive change in their behavior in response to the warnings. Now, let's discuss why the other options are incorrect. B. Doctors now issuing warnings to patients. This option suggests that doctors are now warning patients about antibiotic resistance, but the paragraph does not indicate that doctors are issuing warnings to patients in this context. Instead, it focuses on doctors becoming more vigilant themselves. C. The medical community regretting their carelessness. The paragraph does not explicitly mention regret or carelessness on the part of the medical community. It discusses a change in behavior from complacency to vigilance but does not suggest that the medical community regrets their past actions. D. Practitioners looking ahead to a brighter future. While the paragraph does indicate a positive change in practitioners' behavior regarding antibiotic prescribing, it does not imply that they are specifically looking ahead to a brighter future. It emphasizes their response to the urgency of the problem and their commitment to careful stewardship of existing antibiotics. The correct answer is A. Duty to care for a patient continues after a referral. And here's why it's the correct answer, along with explanations for why the other options are incorrect. A. Duty to care for a patient continues after a referral. This statement aligns with the information provided in the policy document. The document explicitly states that healthcare professionals must be involved in the safe transfer of patients and must check that a named team or clinician has appropriately taken over responsibility when their role has ended in providing a patient's care. This is particularly important for vulnerable patients who do not have the capacity. The document emphasizes the obligation to ensure that the person receiving the referral has the appropriate skills, qualifications, and experience to provide safe care for the patient. This implies an ongoing duty of care even after the referral. B. Ability to look after a patient should be decided by superiors. This statement contradicts the policy document. The document does not mention that superiors should decide who can look after a patient. Instead, it emphasizes the responsibility of healthcare professionals to ensure that the person receiving the referral has the appropriate skills and qualifications. C. Obligation to check up on transfers does not apply to all patients. This statement is incorrect based on the information provided in the policy document. The document does not suggest that the obligation to check up on transfers varies depending on the patient. On the contrary, it emphasizes the importance of checking that a named team or clinician has appropriately taken over responsibility, especially for vulnerable patients who do not have capacity. Therefore, the obligation applies to all patients, especially those in need of extra protection. In summary, the correct answer, A, is supported by the information in the policy document, which highlights the ongoing duty of care for patients even after a referral, as well as the responsibility to ensure that the receiving healthcare professional is qualified to provide safe care. The other options, B and C, are incorrect because they either contradict the document or misinterpret its content.
Let's look at the next question.
The correct option is indeed C, should only be used on patients as a last resort. Let's break down why this is the correct option and why the other options are incorrect. C should only be used on patients as a last resort. This is the correct answer because it aligns with the recommended best practices for using physical restraints. Physical restraints should only be used when all other less restrictive interventions have failed, and the patient's behavior poses a significant risk to themselves or others. This approach prioritizes the safety and well-being of the patient and others while minimizing the use of physical restraints, which can have potential risks and ethical considerations. Now, let's discuss why the other options are incorrect. A can only be administered to patients by qualified staff. While it is important for physical restraints to be administered by trained personnel, this statement alone doesn't capture the full context. Qualified staff are indeed needed to apply physical restraints safely, but this option does not address the timing or appropriateness of restraint use. It's not just about who administers them, it's about when and why they are used. B. Must be applied before patients become aggressive. This statement is incorrect. Applying physical restraints before a patient becomes aggressive is not a recommended practice. The use of physical restraints should be considered as a last resort when all other de-escalation methods, including verbal techniques and medications, have failed. Using restraints preemptively can be considered excessive and may lead to adverse consequences. In summary, the guidelines recommend using physical restraints only when all other options have been exhausted and the patient's behavior poses a serious risk. Option C correctly reflects this principle and is the most appropriate choice.
Let's look at the next question.
The correct answer is indeed C. What to do before administering an IV. Let's discuss why this is the correct option and why the other options are incorrect. C. What to do before administering an IV. This is the correct answer because it accurately reflects the primary focus of the provided guidelines. The guidelines provide instructions on what healthcare staff should do before starting the process of administering intravenous IV therapy. These steps include checking the fluid bag, verifying patient details, obtaining consent, and being diligent in calculating the drip rate. All of these actions occur before the actual administration of the IV therapy. Therefore, this option accurately summarizes the main purpose of the guidelines. Now, let's discuss why the other options are incorrect. A. The procedure to follow when fitting an IV. While the guidelines do cover aspects of the procedure for setting up and administering IV therapy, the primary emphasis is on the steps to take before starting the IV administration. The guidelines mention checking the fluid bag, verifying patient details, and ensuring staff introduce themselves and obtain consent, which are preparatory steps. Therefore, this option is too narrow in scope as it focuses solely on the procedure itself, missing the critical pre-administration steps. B. How to check for issues with IV infusions. While the guidelines mention checking the fluid bag for damage and ensuring the liquid inside it is clear, this is only a small part of the broader context of what healthcare staff should do before administering IV therapy. The guidelines also cover aspects such as verifying patient details, obtaining consent, and calculating the drip rate, which go beyond just checking for issues with IV infusions. Therefore, this option is not comprehensive enough to capture the main purpose of the guidelines. In summary, the main focus of the provided guidelines is on the preparatory steps and precautions that healthcare staff should take before administering IV therapy. Option C correctly reflects this emphasis and is the most appropriate choice.
Let's look at the next question.
The correct answer is indeed B. Aware that even minor illnesses can be distressing for parents. Let's explain why this option is correct and why the other options are incorrect. Be aware that even minor illnesses can be distressing for parents. This option is correct because it accurately reflects the main message of the email. The email is advising pediatricians to recognize and acknowledge the concerns and distress that parents may experience when seeking care for their children, even for relatively minor conditions. It emphasizes the importance of spending time talking to these parents, offering reassurance and support, and understanding that their concerns are valid. The email suggests that addressing parental distress proactively can lead to better outcomes and reduced communication demands in the long run. Now, let's discuss why the other options are incorrect. I'm mindful that parents may not always agree with the proposed treatment. While this statement may be important in pediatric care, it is not the primary focus of the email. The email is primarily addressing the need to recognize and address parental distress, especially for minor illnesses, rather than focusing on disagreements about treatment plans. C. Understanding and patient when explaining conditions to children. This option is not the main message of the email. While effective communication with children is essential in pediatric care, the email primarily emphasizes the importance of addressing parental distress and providing support and reassurance to parents. In summary, the main purpose of the email is to advise pediatricians to be aware of the distress parents may experience when seeking care for their children, even for minor illnesses. Option B accurately reflects this message and is the correct choice. The correct answer is a part of their identity. Let's explain why this is the correct answer and why the other options are incorrect. In the passage, the writer suggests that the loss of voice is difficult for patients because it is a part of their identity. The passage explicitly mentions that our voices define us and are an integral part of who we are. It highlights that our voices allow loved ones to identify us and distinguish us as individuals. This choice reflects the idea that losing one's voice is challenging because it is deeply connected to one's identity. The other options and why they are incorrect. B. Necessary for interaction. While it is true that voice is necessary for interaction, the passage specifically emphasizes the emotional and personal significance of one's voice beyond just interaction. It highlights that the loss of voice goes beyond practical communication. C. Used to form relationships. While voice is certainly a tool for forming relationships, the passage doesn't primarily focus on this aspect. It emphasizes the broader idea of voice being an integral part of one's identity. D. An indicator of social class. The passage mentions that voices can indicate social standing, but this is not the primary reason cited for why the loss of voice is difficult for patients. The emphasis is on the personal and emotional connection to one's voice, not its role as an indicator of social class. In summary, the correct answer, A, aligns with the passage's emphasis on the loss of voice as being challenging because it is a fundamental part of a person's identity.
Let's look at the next question.
The correct answer is C, the limited communication options for disabled people. Let's explain why this is the correct answer and why the other options are incorrect. In the passage, it is mentioned that Reg Malling developed the POSM, patient-oriented selector mechanism, after discovering that patients at the hospital who had lost the use of their voice were only able to communicate using a bell. This information points to the primary reason for the development of the POSM. C, the limited communication options for disabled people. This is the correct answer because it accurately reflects the reason behind the development of the POSM. Reg Malling created the device in response to the limited communication options available to individuals who had lost their ability to speak. Now, let's discuss why the other options are incorrect. A. The number of people who had permanently lost their voice. While it is mentioned that patients had lost the use of their voice, the passage does not specify the number of people as the primary motivation for developing the POSM. The emphasis is on the lack of effective communication options. B. The lack of accessibility in previous sip and puff designs. The passage does not mention any issues with the accessibility of previous sip and puff designs as the primary reason for developing the POSM. The focus is on the limited communication options for those who had lost their voice. D. The recent development of similar sound technology. The passage does not suggest that the development of the POSM was prompted by the recent development of similar sound technology. It primarily highlights the challenges faced by individuals with no voice and the need for improved communication options. In summary, option C correctly reflects the main reason for Reg Malling's development of the POSM, which was addressing the limited communication options available to disabled people who had lost their ability to speak.
Let's look at the next question.
The correct answer is A. They were heavy and bulky. Let's explain why this is the correct answer and why the other options are incorrect. In the passage, it is mentioned that in the 1970s, the first portable, commercially available, adaptive alternative communication devices, AACs, were produced. The passage goes on to describe these devices as often weighing a hefty 15 to 20 pounds and ranging from 20 to 25 inches in size. This information directly points to the problems associated with these early portable AACs. A. They were heavy and bulky. This is the correct answer because it accurately reflects the issue mentioned in the passage. The early portable AACs were problematic because of their weight and size, making them difficult to carry and transport. Now, let's discuss why the other options are incorrect. B. They were remarkably fragile. The passage does not mention any fragility issues with the early portable AACs. It primarily focuses on their weight and size, not their fragility. C. They could not be used while walking. The passage does not provide information about whether these early portable AACs could be used while walking or not. Therefore, this option is not supported by the passage. D. They needed access to a power source. The passage does not mention power source-related issues for the early portable AACs. It primarily addresses their weight and size, not their power requirements. In summary, option A is the correct answer because it accurately reflects the problem associated with early portable AACs, which was their significant weight and bulkiness.
Let's look at the next question.
The correct answer is B. Need for a diverse range of voices. Let's explain why this is the correct answer and why the other options are incorrect. In the passage, the phrase, raising the bar, is used in the context of widening the scope for self-expression among the many users of augmentative and alternative communication, AAC, devices. Specifically, the passage mentions that many users have to make do with a limited number of vocal choices, often with the majority of available voices sounding adult and/or male. This information highlights the need for a diverse range of voices to better represent the users. Therefore, B. Need for a diverse range of voices. This is the correct answer because it accurately reflects the context in which the phrase, raising the bar, is used. The passage emphasizes the importance of expanding the options for voices to allow users to choose a voice that better represents their identity. Now, let's discuss why the other options are incorrect. A complexity of modern devices. The passage does not discuss the complexity of modern devices in the context of raising the bar. Instead, it focuses on the need for a diverse range of voices. C. High quality of the sound recordings. The passage does not mention the quality of sound recordings in relation to raising the bar. The primary concern is the variety and diversity of voices available to users. D. Number of new communication systems. The passage does not reference the number of new communication systems in the context of raising the bar. It is primarily concerned with the range of voices for AAC users. In summary, option B is the correct answer because it accurately reflects the writer's intention in using the phrase, raising the bar, which is to emphasize the need for a diverse range of voices for AAC users to better represent themselves. According to the paragraph, the guidelines for infection control require dentists to strictly abide by the rules set out within the document. This is evident in the sentence, each dental practitioner is responsible for implementing these guidelines in their clinical practice and for ensuring their clinical support staff are familiar with and able to apply them. Therefore, option A is correct.
Let's look at the next question.
According to the paragraph, option A is correct. The paragraph states that they must also be informed that they may choose to consent or refuse any form of treatment for any reason, including religious or personal grounds. This sentence indicates that the option of consent ultimately lies with the patient. Option B is incorrect because the paragraph does not mention anything about patient information being confidential. Option C is also incorrect because the paragraph does not state that patient consent forms are a legally binding document. Therefore, the correct answer is option A.
Let's look at the next question.
The correct option according to the paragraph is option B. Assistance devices should be used over physically handling the patient. The paragraph suggests that ceiling hoist technology and air-assisted patient lifting equipment should be the first-line handling aid considered by employers as they reduce operator and patient injuries. Additionally, the paragraph states that once it has been assessed that equipment should be used for safe patient handling, it should be made available and used even in situations where the patient and/or family's preference is for it not to be used. Option A is incorrect because the paragraph states that overhead tracking should be installed in all new or refurbished facilities, but it does not say that all areas of the hospital should be fitted with overhead tracking. Option C is incorrect because the paragraph clearly states that the decision to use equipment for safe patient handling should be made after an assessment, and even if the patient or family prefer not to use the equipment, it should still be used. The policy does not give patients the final decision on how they should be assisted.
Let's look at the next question.
The correct option according to the paragraph is option B. Mattresses are of standard size so may not be suitable for all bed types. The paragraph mentions that the size of the mattress must be compatible with other bed equipment and accessories, and it implies that there may be some situations where the mattress may not be compatible with certain types of beds. Therefore, option B is the correct answer. Option A is still incorrect because the paragraph does not mention anything about confirmation of equipment availability. Option C is also incorrect because while the paragraph mentions that patient factors must be considered prior to lodging a request form, it is not the main purpose of the notice. The paragraph's main focus is on the eligibility criteria for requesting a pressure mattress and the environmental and equipment considerations that must be confirmed. The correct option according to the paragraph is option C. They can potentially lead to patient harm. The paragraph mentions that the undisciplined use of smartphones can compromise patient care and that personal and routine calls should be minimized and kept as brief as possible. It also emphasizes the importance of avoiding sensitive communications within the hearing of awake or sedated patients. Therefore, option C is the correct answer. Option A is incorrect because the paragraph does not mention anything about a violation of patient confidentiality. While the paragraph mentions the importance of avoiding sensitive communications within the hearing of patients, this is related to patient safety rather than confidentiality. Option B is also incorrect because the paragraph does not state that smartphones are to be used only by the surgeon. Instead, it emphasizes the importance of minimizing the use of smartphones by all members of the surgical team and forwarding incoming calls to voicemail or the reception desk. The correct option for the question, the main point of the extract on subcutaneous cannulas is to explain, is A, the versatility of their design and function. The paragraph describes how a subcutaneous cannula is a small plastic tube that can be used to carry medication into a person's body, and how it has two Y-shaped arms, one of which can be connected to a syringe driver or infusion pump, while the other can be used for subcutaneous injections. The paragraph also mentions that a second cannula may be inserted in case of a malfunction. However, the main focus of the paragraph is on describing the design and function of the subcutaneous cannula. Option B is incorrect because the paragraph does not state that only registered nurses can use subcutaneous cannulas. While it is mentioned that the cannulas are inserted by a registered nurse, this does not necessarily imply that they can only be used by registered nurses. Option C is also incorrect because it only mentions the need for a backup cannula, while the paragraph provides additional information about the purpose of having a backup cannula. Specifically, it notes that having a second cannula can be especially useful if the original cannula stops working at night when nurses may not readily be available. Therefore, the main point of the paragraph is not just the need for a backup cannula, but rather the importance of having a backup cannula in certain situations. Option A is the correct answer because the paragraph mainly explains what a subcutaneous cannula is and how it functions, emphasizing its versatility by highlighting the two different arms of the Y-shaped cannula that can be used for different purposes.